Very pleased today and honored that the Mass Department of Public Health Prevention Wellness Trust Committee is here today to talk to us about e-referral and IT, and I'm guessing the evaluation is going to be mixed in there. So I think the first thing we'll do is go around the room and everybody say who you are and who you're affiliated with so that the team can get a sense of the breadth and expertise that's in the room. So my name's Brenda Weiss and I'm the Director of Health for New Bedford.
I'll go first. I'm Laura Nasudi. I'm with DPH and I'm leading the e-Referral Project, and I'm also part of the evaluation team for the Prevention Wellness Trust Fund.
I'm Tom Land. I'm the Director of Health Information Policy and Informatics at the Department of Public Health, and I'm also working on the evaluation of the Prevention and Wellness Trust.
And I'm Patty Daly. I'm with the Department of Public Health, and I'm going to be working with the clinical partners as a technical assistant quality improvement advisor.
And I'm Bonnie Anders. I'm also with the Department of Public Health, and I'm going to be working on the evaluation of the trust as well.
So either there's growing excitement as the kickoff meeting, or there's buzz about how exciting this presentation is. So you can let me know after which it is. But we have a relatively brief presentation, 30-40 minutes, something like that. But all the other presentations have taken 2 hours. Please feel free to interrupt. This is not intended to be an entirely formal presentation. I'm not an entirely formal person, so just if there's something that either is not clear or you want to ask questions, you can wait till the end, but you can also interrupt. The law was passed in August, something like that, in 2012. We began meetings almost immediately after that. The vision that we had for the Prevention and Wellness Trust was really an outgrowth of what is written in Section 276 of Chapter 224, which is the law of health reform 2 in Massachusetts. 276 has the outcome measures in it. So in large part, the program that you wrote, the application to deliver to us, was based on the giving us the maximum likelihood of realizing those outcome measures listed in Section 276 of the law. They'll be listed a bit later, but what I think will be clear to you is that what we attempted to do was pull together the evidence, look at the potential partnerships, look at the other interventions or the activities at the Department of Public Health to create a vision of how this would operate, that all of you could take advantage of what was happening at the department at the same time that you were utilizing the strengths of what's going on in your community. So the agenda is not much different than what's on the single sheet of paper that's been passed around. This is just a briefer version of it. We'll cover all of these areas. There's some QA and next steps at the very end. We may or may not get to all of those during the course of the conversation. If we do not, you'll have many opportunities to talk to us both today and in the future. We're anticipating very regular conversations, very regular outreach. As we've said at every one of these meetings, our goal is to ensure that all 9 of the grantees succeed. So there are benchmarks that will be developed and disseminated for each of the partners. This is not done to cull anyone from the herd. It is done to try to ensure that progress is being made. We really want to work with you, and we want to work with all the grantees to ensure that they understand what the benchmarks are and that they can deliver on them. The TA is designed and will be designed to maximize your chances of succeeding. The aims of today's meeting are to identify the data sharing. So there's a lot of data that's going to have to be exchanged back and forth. Bonnie, Laura and I are all involved in the evaluation of this. In order to demonstrate the effectiveness of the Prevention and Wellness Trust activities, we're going to rely on the data that you generate and we develop the instruments for. So we'll go over that in broad strokes. A lot of the data collection instruments have not yet been developed, but are in the course of being developed over the next month or 6 weeks. We will begin rolling those out. Probably mid-April, you'll start to see a lot of the information that we're doing. We'll characterize even more of this 10 days, 9 days from now when we have the kickoff meeting. So a lot is happening. Every week there's new progress on all this. We need to work with you to, and each of the grantees, to look at what your current referral practices are. Everybody does, all the clinical partners do referrals. Community-based organizations also do referrals. You may have characterized that in your application, but we'll try to gather more information to summarize that across the grantees. We need to know also in a similar vein what types of QI efforts, quality improvement efforts, each of the clinical partners has engaged in. There's at the core of what is happening with the Prevention and Wellness Trust is this quality improvement effort. So what that will mean is that for each domain, there will be very specific targets and measures that will be provided to you. You will use the data collection instruments we provide, or for example, the electronic medical record systems that you have in order to determine whether you are meeting these targets. And the learning collaborative that is developed among all of the Prevention and Wellness Trust grantees will help you share information about how to reach these targets, or what to do to what hasn't worked, so that you all can learn and gradually improve the speed with which you meet these targets. So the QI efforts are not something that is probably very familiar to a lot of the clinical partners. So this process should not be new, but in some cases the community partners may not have engaged in QI work. So we want all of the groups to participate in something where there are specific targets, there are specific effort to achieve those goals, and then a sharing of information to improve the process. And then finally, whoops, oh, that's okay. Explore referrals, community-based organizations. Oh, so similar to everybody does referrals of some sort, and we just need to know what those conversations are like right now. They're obviously not fully electronic bi-directional referrals as was described in the RFR, but there are referrals that take place all the time. Are they formal, informal? Is there an attempt to gather information about the success of those referrals? So again, with all the grantees, we will be gathering information about what is currently happening in a more systematic way than we did in the RFR application itself. And now the exciting next slide. So the Chapter 224 asks us to meet certain goals. A couple slides later, you'll see what these specific outcome measures are. But they really can be characterized in a simple sentence. They need to know whether this worked. And it needs to know what interventions worked, which communities or which service areas had more success than others, were there certain subpopulations that benefited more than others. But that doesn't satisfy what the Department of Public Health is trying to achieve with the Prevention and Wellness Trust. We also want to look at how this worked. So if one grant site does much better either with one health condition or overall for all the health conditions, we want to learn how success was achieved. And that's the burden of the data collection is probably going to be on the partners in this room to tell us what worked, what didn't work. We'll develop the collection instruments. There will be obviously periodic interviews, outreach with partners when something as successful has been achieved. But the real goal is to 4 years from now, or 3+ years from now, to talk to the legislature and say, the program was a success. We can make it even better next time around because we learned lessons from all of the first round of grantees that we can then offer to the next cohort of grantees in order to increase the likelihood of their success. So this is a graphic that we've used in many presentations, both to the Prevention and Wellness Advisory Board and other groups, to just describe what we are trying to achieve, the vision of the Prevention and Wellness Trust. There are community activities and there are clinical activities, and those things take place all the time anyway. It's what's in the middle that is really defining what's different about the Prevention and Wellness Trust. We are trying to create an ongoing and active communication between clinical providers and community-based organizations. Laura's going to go into a lot of detail about how this e-referral, what we mean by an e-referral, it probably will be helpful just to know how we describe that, what a definition of an e-referral is. But our thought is that if we get a sustained conversation going between clinical and community partners, that when the funding is no longer coming from the Department of Public Health, you have something sustainable. You've got a real mechanism for talking to each other that is easy, and once you do the initial IT investment to get this up and running, it's virtually free to keep talking to each other. The department will host the switchboard, which is what Laura will talk about. But what we're really trying to do is leave you in a better place than where you are right now. You may be in a great place right now, but you'll be in an even better place in 3 years. So as I said, here are the outcome measures for the Prevention and Wellness Trust. We are required by the legislation to develop evidence or to fund evidence-based programs to reduce the prevalence of preventable health conditions, generally chronic conditions. That's one thing. We're also required to produce programs that will reduce healthcare costs or reduce the growth of healthcare costs. We need to, our reports also have to look at the subpopulations and the communities as separately from the whole in order to define which subpopulations or communities benefited most from the intervention. So for example, if there is a group in a community, it may be something where one provider group is much more effective at doing referrals for pediatric asthma compared to another. So if they're serving a particular part of town, then we need to know that to work with the other providers or to develop lessons learned, again, so that the next group of grantees, if we are as lucky to get there, can benefit from all of your experience. The last one of the fourth bullet on there talks about employee health and worksite wellness programs. For those of you who worked on the application materials, that was not a part of what we requested from you, but it is a part of Chapter 224. There will be an RFR coming out relatively soon. Jenna, do you have any idea? No? I know there's conversation probably late spring, early summer. There will be an RFR talking about technical assistance and programs related to worksite wellness. We are already encouraging all of the Prevention and Wellness Trust grantees to apply for this so that they can double up on all their activities. Some of the applicants for the Prevention and Wellness Trust, some of the funded applicants already talked about including employer sites, maybe the municipality, among the sites that were going to do worksite wellness in the original application. This is an opportunity for all of the Prevention and Wellness Trust grantees to do the same thing. The final part of this is the report that we have to give to the legislature. We're required every year to give a report to the legislature. The first one was delivered in January, became official yesterday. It covered the application process, how we chose the applicants, how we decided on what the priority health conditions were. It pretty much encapsulated the information that you all saw in the RFR. The second one will talk about the capacity building and the move from capacity building to implementation for the actual grantees, and some baseline information that we will be gathering in partnership with all of you. The third report would talk about improvements in clinical measures. This obviously is a very fast track to talk about having in the second year of this improvements in clinical measures, but that's what we're planning for the third report. And the fourth one will talk about cost savings. So this is a very, very ambitious schedule, and I have said at a couple of sites, my job is to be sort of a pain in the butt and move things along as quickly as I can, and I'll try to be nice about it, but I'm usually nice about it, right? Okay, but not always. But anyway, it's like, this is such a great opportunity. We're all really excited about trying to pull this off, and we think the grantees have that same spirit that you'll see in the Department of Public Health staff that you'll be working with. but it's a really tight time frame. So we'll just the reason we're trying to provide so many things to you is that if we can give you the TA, we can give you the data collection instruments. If we can do the evaluation for you instead of having you have to search all of that material out, it gives you an opportunity to do the work on the ground as effectively as possible, and we'll provide TA for that as well. But we don't have a lot of time to lose. We don't have a lot of time to debate about how we're going to pull this off. I think we need to work together to figure out the best possible approach to all of this. And we have to deliver a report to the legislature about whether this is successful. So that's about 3 years from now that I think it's July 2016 that we have to deliver a report to the legislature about the success of this program. The data side alone is just overwhelmingly complex, but this is such an opportunity. We've got partners from the universities and the schools of public health around the state who are helping us do this. They've offered a lot of time for free in order to make this successful. We've had inquiries from around the country. There are people who are really pulling for all of you to be successful. So we're putting together a really top-notch team to do TA with you and to work with you on all of these. And I encourage you to consider us a resource. We are not there to sit back and wait for you to call. We'll be doing outreach, but please call us if there are questions. Is that my last one? Nope, sorry. I always forget this one. Obviously there's an enormous amount of work on the grantee side, but I've described some of this in some of the previous comments. We're conducting the cross-site evaluation, and what that means is that we're working with partners. We've got John Snow Incorporated, Northeastern, Harvard School of Public Health, and 2 groups from University of Massachusetts Medical School who are working with us on creating developing the tools that we need for the evaluation. We've also got subject matter experts from all around New England and in some cases all around the country to help us develop the measures that we can use to track progress for all of the grant sites. And so the Department of Public Health, since the report comes from us, has to coordinate the evaluation, but we're also required by the law to have to work with outside evaluators. So that's why we've convened this group of evaluators from universities primarily around the state. As I said, we'll be providing the data collection instruments. In the same spirit of the fact that we gave a data appendix in the RFR, we didn't want you spending an enormous amount of time looking up data that we have at the department already. We wanted you to spend time developing this really large partnership so that you could get off the ground as quickly as possible. So we will be continuing to follow along that path and develop the actual data collection instruments for all of the measures here. As much as possible, we will try to make those as easy to use as possible. There may be some cases where they are paper and pencil, but for the most part, these are going to be electronic systems, either through the electronic medical records or through online surveys that we will be collecting this information. The data collection systems also, that's not your responsibility, that's ours. So all the data that gets delivered to us, whether it is on paper form or an electronic form, that we will be housing that and developing the storage systems for keeping it. Enormous amounts of technical assistance from all domains, the clinical community, from the communications perspective. There's going to be a SharePoint system. Some of you may have used SharePoint to exchange information. There's going to be TA about that. There's TA about all of the QI processes. We've got a team of 4 different TA QI teams that will be working with you. There's also going to be supplemental technical assistance from, as I said, the universities are also offering subject matter experts to come out and work with you on particular health conditions when those become the focus of the quality improvement work. And finally, as I mentioned, this is a learning collaborative, and there's an attempt to bring you together. We'll bring you together 4 times a year. So every quarter there'll be a face-to-face meeting with all of the grantees. And what we're trying to do with that is to allow you to share experiences, positive and negative, with your fellow grantees in order to meet your targets as quickly as possible. So there'll be benchmarks set, there'll be targets set. That's something that's in the works. But the real goal is to have you learn from each other in order to, I don't think that we're in a position to tell you how something works on the ground when you're actually experiencing it. So if you can work with the other grantees, you're likely to benefit when someone else does it better, or they'll benefit when you have achieved something more quickly than they have. And our role is to be the facilitator of those conversations.
Great. I'm just going to introduce the e-Referral project now. First, I'm going to give you a little background, and at any point, feel free to ask questions. A large part of what we're doing here today is introducing you to a lot of the things that we've been working on behind the scenes, but we expect that you have questions either from what we're presenting today or things that you've been thinking about since you found out that you were awarded the PWTF. So first of all, the e-Referral project is coming out of Massachusetts State Innovation Model Testing Award. Massachusetts was one of 6 states to win a State Innovation Model Testing Award. On the right, you see all the different projects. E-Referral is just one of those 11 projects that was funded as part of this award.
Yeah, no, and I think we're all excited. You'll see a lot of that excitement on the 13th.
Okay.
This is really, this is a great opportunity that we're embarking upon, and we're really happy to have you as partners.
Excellent.
Thank you.